Hello, my name is Ruth Fiddler. I'm glad to have this opportunity to present research that I've been doing for Texas A&M Commerce Public Health Program over the last few weeks regarding poliomyelitis, also known as polio, in Pakistan, and how they are coping with tackling eradication efforts to avoid resurgence. Polio is a highly contagious waterborne human enterovirus that spreads easily from sewage-contaminated water or food products, improper hygiene, and poor living conditions. The World Health Organization reports polio, a diarrheal disease, can spread to the central nervous system and cause irreversible paralysis, muscle weakness, and prevent breathing, resulting in death. For this reason, children under the age of 5 are the most susceptible to contracting polio due to the fecal-oral route, or hand-to-mouth, their underdeveloped immune systems, and dehydration-related deaths due to uncontrolled diarrheal issues. Polio has evolved to 3 different serotypes or strands. The first type, WPV1 or wild type. The second and third type are CVDPV1 and CVDPV3, respectively, which are defined as circulating vaccine-derived poliovirus 1 and 3. Pakistan is one of 3 countries still affected by polio, a disease on the verge of global eradication. 24.7 million of the 235 million population in Pakistan, considered to be a low to middle income country, are children under the age of 5. According to the World Health Organization, polio reached its peak in the 1980s, where incidence has dropped from 350,000 to nearly 6 cases in 2022. Despite these huge health gains, Pakistan's efforts to eradicate polio have continually failed due to multifaceted and multi-level issues. For example, intense focus on COVID vaccination efforts and lockdowns placed significant stall on polio eradication efforts and negated 40 million children from receiving polio vaccines or boosters. Other challenges include conspiracy theories against the vaccine due to erosion of patient-provider relationships, international policy relationship erosion, and allegations of ingredients like porcine pig fat, a violation of a religious belief. Violence from extreme groups have mobbed hospitals and clinics and even injured or killed workers who were going door to door to deliver vaccines to children. The motive is that the rumors of the vaccines come from the U.S. and relationships between the U.S. and Pakistan has declined after September 11th and the September 11th attacks on the United States World Trade Center. There are also challenges and barriers of lack of clean water and proper sanitation, poor hygiene, and poor education of the population, the public, or the health workers to help quell the unfounded rumors. However, if even one child remains ill, resurgence is a real possibility. The CVDPV1 and CVDPV3, which again stands for the dormant vaccine-derived poliovirus, comes from a dormant virus within the vaccine that has evolved due to the fears and concerns that kept families from giving booster vaccines to their children. Finding the answers to avoid resurgence is no easy task. Multiple organizations and programs within Pakistan and international support continue to battle for complete eradication of this deadly disease. Government leaders and health organizations are confused as to why the hostility and conspiracies and where they came from, considering that Pakistan has already successfully eradicated smallpox using vaccinations. Research conducted over these last 2 weeks reviewed peer-reviewed journals, government organizations within Pakistan, and programs that unite together for sustainable eradication goals by 1, empowering prevention through clean water and sanitation efforts, a sustainable goal. 2, empowering education, a second sustainable goal. And 3, by promoting, campaigning, and designing vaccination initiatives through partners like Rotary Club Pakistan, WHO, the World Health Organization, UNICEF, Gavi, which stands for the Global Alliance of Vaccination Initiative, and the Gates Foundation, formerly known as the Bill and Melinda Gates Foundation. Unitedly, they have raised $2.7 billion in vaccination efforts. Additionally, establishing the PPEP under the Rotary Club of Pakistan direction, short for the Pakistan Polio Eradication Program, which heads the 1988 Tanker a Day Clean Water Initiative to remote areas in need. There is also the GPEI, or Global Polio Eradication Initiative, also governed by Rotary, which established the door-to-door vaccination efforts to make sure no child is left behind. The GPEI is partnered and funded by Gavi, the Global Alliance for Vaccination Initiative, and the Gates Foundation helped fund and establish a national emergency center in Pakistan to root out problematic areas of disease spread, train health workers to educate population, to quell the rumors about the vaccine, and to combat outbreaks before they resurge to a global issue again. The government of Pakistan is rooting for eradication as they support continued vaccine campaigns, including setting up border vaccination centers in areas of highest prevalence, especially between Pakistan and Afghanistan, 2 of the 3 remaining countries where polio is still endemic, and by partnering with the World Health Organization for tracking and for disease prevention measures, and to reestablish international relationships and ties to regain the public's trust again. If we take a look at the infographic at the chart at the bottom of the poster, we see the fluctuation of reportable cases of polio since 2000. Pakistan has faced several setbacks for every health gain due to challenges and barriers. Aside from the challenges of needing clean water and sanitation, the challenges of poor education, population violence, and conspiracy theories, there are barriers that prevent polio from reaching complete eradication. For example, mistrust over vaccine ingredients that cause panic, such as potential porcine pig ingredients, weakened influence of public government programs like the National Ministry of Health, which devolved in 2011 and then was reinstated again in 2013, but only after the public health responsibility was transferred to the Pakistan Medical and Dental Organization. Despite these challenges, the National Emergency Operations Center 2022 reports polio case incidences are down 99% from the 20,000 cases in the 1990s to a mere 6 cases in 2022. Pakistani health officials are hopeful that eradication is within reach. The National Ministry of Health 2022 core mission is to remain committed to continuous population health with a vision of quality, affordable, accessible healthcare, and stand with the rest of the world to eradicate polio for good. With continued local efforts of the National Ministry of Health, the Gavi Vaccination Alliance has provided 822 million children with vaccines globally, including Pakistan, and prevented 14 million child deaths. Gavi leads the primary coordinator for uniting funding from WHO, Rotary Club Pakistan, UNICEF, World Bank, the Gates Foundation, and the National Ministry of Health, while serving as primary educator of innovative preventative ideas to educate the public on the importance of clean water, good hygiene, education of the population and health workers to rid the world of polio, HIV, TB, malaria, yellow fever, and other deadly diseases. To do so, philanthropic organizations and programs must remain vigilant in vaccination efforts. They must be able to provide sustainable clean water and sanitation education efforts, education on proper hand washing and with antibacterial soaps, and proper sanitation disposal. The drive to educate the population and health workers must meet the sustainable goals mentioned and continue to improve on new goals and ideas to create a health system that is indeed efficient, accessible, and affordable for all. Any internship work and opportunities with Gavi would be an interesting way to provide firsthand knowledge and experience of the challenges that Pakistan is facing against the public population health initiatives and global outreach programs. It could provide opportunities to inspire and cultivate new ideas to strengthen the positive influence of these health groups and outreach programs while campaigning not just for the vaccines, but for improved sustainable efforts of valuing education, valuing clean water, and improved sanitation systems, tackling a multi-level, multifaceted issue in eradicating polio permanently. If you would like to know more about the resources that I use for this project, you can take a look at the reference list here. But before you go, have you ever heard of anyone or know of someone who's ever been affected by polio? If yes, based on this presentation, what are some improvement ideas that you may suggest that might help Pakistan overcome pushback and reach complete polio eradication? And if not, what shocked you the most about this disease? How does this inspire you to promote sustainable development goals and not take clean water and sanitation for granted? Are there any questions? Thank you. If you have any questions, you may reach out and contact me at Ruth Fiddler, rfiddler@leomel.tamuc.edu, or reach out to the course professor, Dr. Elizabeth Washira, elizabeth.washira@tamuc.edu. Thank you for joining this presentation. Signing off.